Okay, so let's dive into something that feels, well, really personal, our health data.
Right.
I mean, most of us probably assume our medical history, fitness stuff from our watches. It all belongs to us, doesn't it?
That's definitely the common assumption, yeah. But our source paints a slightly different picture.
Oh, so.
Well, the moment that data goes into, say, a hospital's computer system
Yeah.
or, your wearable syncs with an app or even the insurance company portal,
Aha.
it kind of changes. It starts acting more like a commodity.
A commodity, like
Yeah,
something bought and sold.
exactly. It takes on value for other people, not just you.
Wow.
Yeah.
Okay, that's a bit of a mind shift. So, practically speaking, who's actually benefiting from my health info becoming a commodity?
Well, the source points to a few key groups. You've got data brokers, for instance.
Data brokers.
Right. Yeah, they collect huge amounts of this stuff, package it up, and sell it. And that info can be used to, like, target ads at you, maybe for treatments, maybe things you don't even really need. Or it could even influence, say, insurance risk calculations down the line.
Okay, yeah. And besides brokers.
Advertisers, obviously, looking for very specific groups. And increasingly, AI developers, they need massive, massive data sets to train their health algorithms.
Right. AI needs data. Lots of it. It's a bit unsettling thinking about how far that information might spread. Now, the source also mentions the Self-Research Institute.
It does, yes.
What's their take on all this?
They have a very clear stance. They basically believe your health data is an extension of you, like fundamentally part of you.
Okay, I get behind that.
And so their argument is it shouldn't be bought or sold or even just moved around without your explicit say-so, your informed consent.
That makes intuitive sense. It feels right,
Right.
It's my health. Are they just talking about this or actually doing something?
Oh, they're definitely doing something. They're focused on building tech that puts privacy first, right from the design stage.
How does that work?
So things like developing secure data standards. Think of them as like agreed rules for handling sensitive info safely, makes it harder for leaks or misuse.
Right, standards.
And strong encryption, of course. Scrambling the data so it's basically unreadable without the right key.
Okay.
And crucially, working on ways to give you more direct control over your own data. User-centric controls.
So moving away from our info, just sitting in these big company databases we can't really see into.
Exactly, giving the individual more power. Which brings us nicely to this idea of data sovereignty in healthcare.
Data sovereignty. Tell me more about that.
In this context, it really means you have the ultimate authority over your digital health information. You decide who gets to see it, how they can use it, and why. It's about putting you back in the driver's seat.
Data sovereignty. That feels quite powerful, especially for something as sensitive as health, which, listening to this, it really brings up a big question for you listening right now. Should your health data be treated as a basic human right?
Yeah, it's a key question. So just to quickly recap the main points.
Please.
We've seen this tension, right, between how we feel about our health data, that it's ours, and the reality our source describes, where it's often treated more like currency.
Right, the commodity aspect.
Yeah.
And then there's the alternative approach from the Self-Research Institute.
Yes, pushing for privacy through better tech-secure standards, encryption, and this core idea of data sovereignty, giving individuals control.
So thinking ahead, especially with healthcare getting more and more digital, it leaves us with a pretty important thought, doesn't it? If we don't get more control over our personal health data, what are the long-term implications? What does that future look like?
That's definitely something to mull over, especially as this technology keeps evolving so quickly. What does it mean for you personally down the road?